Do you know that most women can't get pregnant because they are having polycystic ovarian syndrome? And just in case you don't know, why you might be having that irregular menstrual cycle is because you are having polycystic ovarian syndrome, or maybe you are having early signs of polycystic ovarian syndrome. And that's why you will need to pay close attention to everything I'll be explaining in this video, so you would know what is polycystic ovarian syndrome, the signs and symptoms you might experience when you are having polycystic ovarian syndrome, and most importantly, the treatment option for polycystic ovarian syndrome. So let's get started with what polycystic ovarian syndrome. So polycystic ovarian syndrome is a hormonal disorder affecting women of childbearing age, women within the age of 15 to 45 years. Though sometimes this condition might affect women below 14 years of age, and it might also affect women above 45 years of age. But for the sake of this video, we're going to be looking at polycystic ovarian syndrome that affects women within the age range of 14 to 55 years of age, because this is when it has so much impact on women, causing infertility and so many menstrual abnormalities in women. So we're going to be looking at all of that in this video, so you would know how to manage this condition and how to treat this condition successfully in case you're that kind of person that has been struggling with this condition. So in case you're seeing this for the first time, please do well to subscribe to our YouTube channel so you can get more amazing videos like this. And don't also forget to share this video to as many people as you can. You might be saving the life of someone. Now, one of the major effects polycystic ovarian syndrome will always cause to women is irregular menses. So as a young woman, if you're having polycystic ovarian syndrome, you will always experience irregular menses because your hormones will be imbalanced. And this happens when you are either having a kind of shift in the days of your menstrual cycle. If you're that kind of person that do see your cycle every 28 days, every 29 days, it now changes to 30 days, to 40 days. You're now seeing your cycle every 35 days, every 30 days as the case may be. It now changes in days. Then you should know you are having an irregular menstrual cycle, and this is mostly caused by polycystic ovarian syndrome. If you're also that kind of person that do see your menses every 28 days and it now changes to 27 days, to 25 days, 24 days as the case may be, you should know you are having an irregular menstrual cycle, and this can be caused by polycystic ovarian syndrome. If you're also that kind of person that do see your flow for 4 days, for 5 days as the case may be, and it now changes to 7 days, you are seeing your flow for 8 days, for 10 days, you should know you are having an irregular menstrual cycle, and this can also be caused by polycystic ovarian syndrome, and that's why you will need to visit a gynecologist so they can give you medications to manage this condition at early stage. Now, there are so many signs and symptoms that this condition will always present with. There are so many ways you will know you are having polycystic ovarian syndrome when it's in your body, because this condition is not asymptomatic, it's always symptomatic. You will see signs and symptoms once you are having this condition. And one of the major signs and symptoms that this condition will always show in the body is weight gain. So as a young woman, if you're just experiencing a kind of sudden weight gain and you think it's enjoyment, it might not be enjoyment, it might be polycystic ovarian syndrome. Or you might be having obesity, too much fat growth in your body. Don't forget, you being fat does not mean you are having obesity. Sometimes you might be slim and you still have obesity, where there will be much fat deposit in your body. This is mostly caused by polycystic ovarian syndrome. And sometimes you might also experience too much hair growth on your body. As a woman, you experience hair growth on your jaw, on your chest, on certain areas of your body. Your body is just producing too much hair. You are having acne, you are having mood swing. As a woman, you don't just want to talk to anybody. You want to be isolated, you want to stay alone, you don't feel like talking to people, you don't feel like anybody coming close to you, you're always irritated. This is caused by polycystic ovarian syndrome, and you will need to visit a gynecologist as soon as possible in case you are having these signs and symptoms. You will also experience irregular menses, as I've rightly explained earlier, and you would also experience fertility issues. Once you are having irregular menses, you can't track your ovulation, you don't even know the days you're ovulating, so you don't even know the best time to meet your partner in case you want to get pregnant. Or you're that kind of person that have been struggling to get pregnant, and despite all your trials, you're unable to get pregnant. This is mostly caused by polycystic ovarian syndrome, because polycystic ovarian syndrome mostly affects egg production. As a woman, you might not produce egg when you are having polycystic ovarian syndrome because the ovaries are affected, and that's why you might not get pregnant as a woman. So if you're that kind of person that may be having fertility issues, you will need to check yourself for polycystic ovarian syndrome, because this might be one of the major reasons why you are not getting pregnant. What causes polycystic ovarian syndrome? The other question that people are always worried about and they would want clarification on is what causes polycystic ovarian syndrome. People keep talking about PCOS and they don't even know what causes this condition. Now, the main cause of polycystic ovarian syndrome is not yet known, but there are factors that can increase your risk of having polycystic ovarian syndrome. And one of the major factors we mostly explain is family history of polycystic ovarian syndrome. So as a young woman, if your family member do had polycystic ovarian syndrome, your mom had polycystic ovarian syndrome, your aunt had polycystic ovarian syndrome, or your grandmom had polycystic ovarian syndrome, it means you might be at high risk of having polycystic ovarian syndrome. And that's why you will need to know the major signs and symptoms so you can relate this with your doctor in case you have been struggling to get pregnant and you don't even know what is making you not to get pregnant. You need to discuss this with your doctor so they can check you for polycystic ovarian syndrome. Because one of the major mistakes that most women do is not even checking themselves. They might be thinking it's a kind of normal thing or it's some kind of village stuff, some kind of spiritual stuff. And sometimes it's not spiritual stuff, it's just because you're having polycystic ovarian syndrome and you might be having a kind of imbalance in certain hormones which can be supplemented with certain medications. So it's always advisable you discuss this with your doctor in case you're that kind of person that have had family history of polycystic ovarian syndrome so they can check you and recommend the best medications that will help your condition. The other factor that can also increase your risk of having polycystic ovarian syndrome is hormonal imbalance. So as a young woman, if you're that kind of person that's producing too much androgen hormone is a male hormone, a hormone that should be produced in high level in men. So as a young woman, if you're producing this hormone in high quantity, it means you might be at risk of having polycystic ovarian syndrome because this condition can make you not to ovulate, it can make you not to release egg as a woman, it can make you not to produce egg as a woman, and it might be one of the major reasons that you'll be having a kind of high hair growth. You may be producing too much hair growth in your body, on your jaw, on your chest, your private area, your hands, your legs. This is mostly caused by polycystic ovarian syndrome. You might also be having baldness where you'll be having hair loss, you'll be having skin issues, acne. This is also caused by high production of androgen hormone, and this can increase your risk of having polycystic ovarian syndrome. If you're also having insulin resistance, and that's why people with diabetes, these people might be at risk of having polycystic ovarian syndrome because most people with diabetes, the insulin resistant diabetes, can be linked to polycystic ovarian syndrome, and that's why when you are having this kind of condition, you will need to discuss this with your doctor in case you're that kind of person that is struggling to get pregnant and you don't know why you're not getting pregnant. This might be one of the major reasons why you're not getting pregnant because this insulin resistance might make you to have polycystic ovarian syndrome, and these are conditions that we manage, and we're going to be looking at all of that by the end of this video. The other factor that can increase your risk of having polycystic ovarian syndrome is environmental factor. And most people don't even talk about this, but it's a topic of high relevance. We need to talk about that today so you can understand and avoid some things you need to avoid in case you're that kind of person that will be neglecting some of these things. And one of the environmental factors is stress. As a woman, if you're always stressing yourself, you might be at risk of having polycystic ovarian syndrome because stress can reduce your body immunity. It can reduce your body metabolic rate, and this can increase your risk of having polycystic ovarian syndrome. Lack of exercise burns some kind of free radicals in the body. It kind of helps the body to rejuvenate easily. It helps the body to metabolize easily. So if you're that kind of person that don't exercise your body very well, you might be at risk of having polycystic ovarian syndrome. Poor diet. If you're that kind of person that don't eat well, you don't control your diet, anything that comes to your line, you're always eating. You see carbonated drinks, you take fresh food, you take cooked food, you take everything that comes to your line, you're always eating them. What most of you don't know is most of these things might be sensitive to your system and you might be having allergic reactions to some of these things. And when you take them, instead of having a kind of positive effect on your body, they end up causing a negative effect on your body. And that's why you must always watch whatever you eat as a woman. This can affect the quality of egg you produce. Not even polycystic ovarian syndrome alone. It can cause so many problems to your body. It can increase your risk of having certain cancers. And that's why you must always watch your diet as a person. Now, the other factor that can increase your risk of having polycystic ovarian syndrome are medical conditions. Certain medical conditions can make you have polycystic ovarian syndrome, and one of them is Cushing syndrome. If you're having Cushing syndrome as a woman, you should know you might be at high risk of having polycystic ovarian syndrome. If you're also that kind of person that is having thyroid disorder, you're having problem with your thyroid, you should know you might be at risk of having polycystic ovarian syndrome because thyroid is one of the major organs that helps in metabolism in the body. It's also one of the major organs that helps in controlling the production of certain hormones in the body. So once you are having the disorder of your thyroid, it means you might be at risk of having polycystic ovarian syndrome, and you might need to discuss this with your medical doctor in case you notice this condition at early stage so they can know what is making you not to get pregnant and what might have caused your polycystic ovarian syndrome. Now, I'm talking about the treatment option for polycystic ovarian syndrome. I know this is what most people might be waiting for, but it's very important to know that once you are having these signs and symptoms I've just explained, it's always advisable you visit a medical personnel, go to the hospital so they can check you to know what is actually wrong with you, because all these signs and symptoms I've explained might be caused by other conditions. It's not only polycystic ovarian syndrome that causes them, but it's mostly linked to polycystic ovarian syndrome, and that's why you need to visit a medical personnel so they can check you to know and be sure you are having polycystic ovarian syndrome before you can start taking most of these medications I'm going to be explaining in this video. And don't also forget that these medications I'll be explaining in this video is for educational purpose only. It's not meant to guide you on the medications you should take when you are having polycystic ovarian syndrome, because these medications need thorough guidance when you are taking them. Now, one of the major things you can do to manage and treat polycystic ovarian syndrome is lifestyle change. So if you're that kind of person that do eat anything that comes to your line, make sure you reduce what you eat. If you're that kind of person that don't do exercises, make sure you're always doing exercises. If you're that kind of person that's always stressing yourself, you should know you need rest. Start resting from now henceforth. And there are other medications you might need depending on the goal and objective of your treatment. If you're having hormonal imbalance, you might prescribe some kind of hormonal pills for you, some kind of birth control pills to regulate your menstrual cycle and also to reduce your androgen level. Because once you are having polycystic ovarian syndrome, you might be having hormonal imbalance, and this can make you to have irregular menstrual cycle. And once you are having irregular menstrual cycle, you might not even know how to track your ovulation. You might not know when you are ovulating, and this could not help you get pregnant because you might not know when to meet your partner. So as a person, if you are having an irregular menstrual cycle as a result of polycystic ovarian syndrome, you might need to take some kind of birth control pills to regulate your menstrual cycle and also to reduce the level of androgen hormone, because this hormone can make you not to ovulate. It can make you to have an irregular menstrual cycle. It can make you to produce certain hormones in your body that you're not supposed to produce because you're having a hyper production of this androgen hormone. The other medication that doctors will always prescribe are fertility medications. Medications that can boost your fertility, medications that would make you produce egg as a woman. And one of the major fertility medications, medications that can help you boost your ovulation, that will help you produce an egg as a woman, is letrozole and clomipene. This medication can help you regain back your fertility, because once you're having polycystic ovarian syndrome, you might have a reduced ability to produce healthy eggs, and it can even stop you from producing eggs completely, because once you're having polycystic ovarian syndrome, there is a fluid-filled sac that's been produced on your ovaries, and this can prevent you from getting pregnant as a woman. So after watching this video, if you enjoy it, please do well to subscribe to our YouTube channel so you can get more amazing videos like this. And if you have questions you wish to ask about this particular topic, or you have an experience you wish to share with us, please do well to drop it in the comment section so we can respond to you as soon as possible. Thank you for watching this video. I'll see you next time.